Hi everyone, I'm Zihang from Complex System Lab in the Pennsylvania State University. Today I'm going to talk about our research on hierarchical Gaussian process modeling and estimation of state transition dynamics in breast cancer. We all know breast cancer is a very common cancer type. From American Cancer Society, we know the estimated number of female breast cancer accounts for the most prevalent cancer type in the United States. And the number of breast cancer death cases is also very high. It's in the third place of number of death cases. Lots of work has been done on breast cancer. Previously, many studies have been done on how to take preventive actions to reduce the incidence of breast cancer. And there are studies on what factors will affect the breast cancer incidence and in which way. And there are some other researchers about the biological part of breast cancer. So our research question here is how the breast cancer behave over time. And we want from data's perspective to find a way to tackle this problem. For the data, we use database from SEER, and we eliminate those male breast cancer cases because in this study we only consider female breast cancer. Here is the real data structure from our database. So for each entry, we have in total 397 positions to represent all kinds of information, like patient ID, region where the patient gets treatment, and further each position will provide us some information like the treatment they have conducted and their age and the cancer stage and so on. For instance, here we have a patient who got into system for 6 times, and we can see how the breast cancer progress over time. Luckily for this patient, we have in total 6 data entries, so we can track her situation. But for most of the patient we have in the database, we only have 1 data entry, which means we can only know what kind of breast cancer that patient had and what kind of treatment the patient did. But we do not know how the breast cancer progressed after that, which introduced the problem we will talk about later. After pre-processing the data, we got a look into the database. First, we can see some connections between the treatment selections and the cancer stage, and the connections between treatment selections and age here. Here's the distribution of cancer stage. Here we notice the little jump at age 39 and age 40. And we think this is because most of the guidelines for preventive actions for patients like screening tell people to take actions after maybe 40 years old. So maybe this can give us some information we should ask people to take action earlier than 40 years old. Maybe this can help people better. So with the data we retrieved from the SEER dataset, we defined our Markov-Chain model. Our states are defined as age, health condition, and treatment histories. And our treatment consideration, the age we are considering is from 25 years old and 65 years old. And our health condition is defined by different cancer stages and deaths. And treatment methods are treated as a binary variable. For estimating the transition probability, we use a conditional probability, but because of the shortage of the data we mentioned before, for most of the condition, we do not have usable data to calculate the transition probability, which results in many missing elements in our transition probability table. And for that, we need to use another methodology to solve this problem. For missing value imputation, many researchers use multiple methodologies like delete the missing value or take the mean or median, or use a linear regression or Gaussian process to predict the value. But all of those methodologies cannot capture the data connections from multiple dimensions very well. So here we developed the HGP, hierarchical Gaussian process, to solve the problem. So for here, the Gaussian process, hierarchical Gaussian process will use one dimension at a time to estimate the missing value. Then update the value from another dimension to get a more accurate value. Here we first input the A point from each dimension. Then we use the information into estimation in treatment history dimension. So we can use the data to update the information in cancer stage dimension. Then we got the estimated value information from all three dimensions. In order to show the effectiveness of our methodology, we proposed a validation experiment. First, we remove some data from our available transition probability table. Then we estimated the removed data with linear regression, Gaussian process, and HGP for 100 times. Then we plotted the RMSE, which is a root mean square error. As we can see, the HGP has the lowest RMSE for all three percentages, which means our methodology is effective. Here we have an example of a patient with no treatment history from 39 years old to 40 years old. In total, in this research, we encountered some challenges like large and complex structured datasets and the discrete data, which makes us unable to trace further progression of patients. And because of this, there are some missing elements in our transition probability table. How contributions are we looking inside into the data to get some information about the treatment selection and the stage distribution. And we estimated the transition dynamics in breast cancer, which is a limit. What is the limitation of our research is there are some narrow assumptions in our problem setting. For our future research, we want to resolve those assumptions first. Then we want to make this model more complicated. And we are thinking to do some constrain the Markov decision-making process to find the optimal treatment for patients. And I want to thank the support from NSF Chart and Susan Gicoma for this research. If you have any further questions, please contact me or Dr. Hui Yang. Thank you for listening.